Dear students, let us discuss about the nasal septum. Nasal septum is a median osteocartilaginous partition between the two halves of the nasal cavity, and it is covered by mucous membrane. The nasal septum is nothing but the medial wall of nasal cavity. In this picture, you can see the pyriform aperture in relation with the anterior part of nasal cavity you are seeing, and there is a partition separating the right and left nasal cavities. So this is the nasal septum, and in each of the nasal cavities you can see the inferior meatus and middle meatus of the lateral wall, and also the middle concha and inferior concha. So the nasal septum is an osteocartilaginous partition, as it is formed by both bone and cartilage, and it is the partition between the two halves of nasal cavity, and it is covered by mucous membrane. The two nasal cavities are not symmetrical. They are asymmetrical as the central part of nasal septum is deviated to one or other side. So, the nasal cavities are asymmetrical. And one explanation for this is there is bending at the omero-ethmoidal junction. Because of that, the septum is deviated to one or other side. In this picture, you can see the two nasal cavities and the nasal septum, the bony part of which formed by perpendicular plate of ethmoid bone anteriorly you are seeing. And here you can also see the lateral wall showing the bony concha, and in between them the meatuses, superior, middle and inferior meatuses. This is the floor of the nasal cavity formed by the palate, and you are seeing here the roof of the nasal cavity formed by the ethmoid bone. In this picture, you can see the nasal septum. In this picture, you can see the bony part of it, the nasal septum, which is contributed by the perpendicular plate of ethmoid and the vomer with a smaller contributions from the adjacent bones, the maxilla, the palatine bones, the frontal bone, and here you are seeing this is the crista gully in relation with the frontal bone, and this is the upper margin of the nasal septum, and this is the posterior margin of it, and here you are seeing the sphenoidal air sinuses, and this is the fossa for the pituitary gland. This is the one you are seeing, and then this is the anterior part. Here you may see the septal cartilages. In this picture you can see the both bony part and cartilaginous part of nasal septum, and this is the superior margin. In relation with that, you have seen the cribriform plate of ethmoid, and then in this picture you have identified the crista gully, and here you can see the sphenoidal air sinus, and then this is the fossa for the pituitary gland, and this is the posterior margin of the nasal septum, and this is the inferior margin and the anterior margin. Anteriorly you are seeing the cartilaginous part of nasal septum. Now let us see how the nasal septum is formed, as it is partly bony and partly cartilaginous. The nasal septum If you see here, you can see the bones forming, and in the anterior part there is a wedge-shaped gap which is formed by the cartilaginous part. And if you see the nasal septum, it has got 4 borders and 2 surfaces. The 4 borders are the superior border, the inferior border, the anterior border and the posterior border. The 2 surfaces are the right and left surfaces, as it is the partition between the 2 nasal cavities. And in this picture you can see the bones contributing for the nasal septum. So you can identify the perpendicular plate of ethmoid and the vomer, which will be the major contribution. Then the smaller contribution from the maxilla and the palatine bones, and also from the nasal bone and from the frontal bone, and the sphenoid can be learnt in the subsequent slides. So you have understood about the 4 borders and 2 surfaces of the nasal septum. Now let us learn about the bones forming and the cartilages that are contributing for the nasal septum. And here you can see that the postero-inferior part of the nasal septum is formed by the vomer, which is contributing for the nasal septum below and behind. And the antero-superior part, it is contributed by the perpendicular plate of ethmoid bone. And around the edges of the septum, you can see the contributions from the nasal bone, that is the nasal crest, and the frontal bone that forms the nasal spine, and from the sphenoid, the rostrum and the sphenoidal crest. The maxilla, the horizontal plate, is contributing, and then the palatine, process of the palatine bone. These are the contributions from the various bones. The cartilaginous part is the anterior gap, and it is filled with septal cartilages and the septal process of inferior nasal cartilage. Coming to the lining membrane of the nasal septum, it is lined by mucous membrane, and the mobile part, the anterior part, it is lined by the skin, and rest of it is covered by the mucous membrane, which is of 2 types. One is the olfactory type, which you will see in the upper part, where the olfactory cells, hairs and the olfactory nerves will start that pass through the cribriform plate of ethmoid bone to join the olfactory bulb. Then the rest of it is the respiratory type, that is lined by ciliated columnar epithelium. In this picture you can see the lining membrane covering the nasal septum, and in the anterior part this area is covered with skin, and in the upper part this is the area covered with olfactory epithelium, and rest of it is covered with the ciliary epithelium, that is the ciliated columnar epithelium, that is the respiratory type. And in this picture you can see the posterior nasal aperture and the nasopharynx with the opening of the auditory tube you are seeing, and this is the sphenoidal air sinus, and above it you are seeing the sella turcica of the sphenoid bone, and this is the frontal bone, and this is the nasal bone, and you are seeing the hard palate and the soft palate. Now let us understand about the blood supply of the nasal septum. For this, This can be divided into 4 quadrants, that is the anterosuperior, anteroinferior, posterosuperior and posterior-inferior quadrants. The arterial supply for the anterior superior quadrant is by the branches of the ophthalmic artery, which is a branch of internal carotid artery. And the branches from the ophthalmic artery are the anterior and posterior ethmoidal arteries. Coming to the posterior-superior part, it's by the branch of the external carotid artery, that is the maxillary artery, which gives the septal branches of the sphenopalatine artery, which are supplying the posterior-inferior part. So posterior-inferior part is supplied by sphenopalatine artery through its septal branches, and the sphenopalatine artery is a branch of maxillary artery, which is a branch of external carotid artery. Coming to the anteroinferior part, the blood supply is important to this area, and this is known as the Little's area or Kesselbach's plexus, as the blood vessels that are supplying this area are forming a plexus, which is known as Kesselbach's plexus, and this plexus is formed by branches of the internal carotid artery and external carotid artery. The branches of the internal carotid artery are the anterior and posterior ethmoidal arteries. The branches from the external carotid artery are the branches of the maxillary and facial arteries. The branches from the maxillary artery are the sphenopalatine artery, the greater palatine artery, and the branches from the facial artery are the septal branches of superior labial artery. So these are forming the plexus known as the Kesselbach's plexus. And this plexus can be remembered with a mnemonic GAPS, GAPSS, of which G stands for greater palatine artery, A stands for anterior ethmoidal artery, and P stands for posterior ethmoidal artery. The one S starts for is representing the septal branch of superior labial artery, and other S for the sphenopalatine artery. So that is about the anteroinferior part. The posterior-inferior part is supplied by greater palatine artery, which is a branch of maxillary artery. That's about the arterial supply. Coming to the venous drainage, from the anterosuperior quadrant, the veins drain into the superior ophthalmic vein, which drains into cavernous sinus. And from the posterior superior part, it will drain into the inferior cerebral veins, which will join the cavernous sinus. From the anteroinferior part, it drains into the facial vein, and from the posterior inferior part, the veins drain into the pterygoid plexus of veins. That's about the blood supply of nasal septum. Coming to the nerve supply, for which also we have to consider under the 4 quadrants, and we have to consider about the general sensation and special sensation. The general sensation from the anterosuperior part is by anterior ethmoidal nerve, which is a branch of nasociliary division of ophthalmic division of trigeminal nerve. And from the posterior inferior part, it is through nasopalatine branch of pterygopalatine ganglion. From the anteroinferior part, it is through the anterior superior alveolar nerve, a branch of maxillary division of trigeminal nerve, and also external nasal nerve, a branch of ophthalmic division of trigeminal nerve from the mobile part of nasal septum. Coming to the posterior-inferior part, it's by nasal branch of greater palatine nerve from the pterygopalatine ganglion. So, the general sensations from the nasal septum are conveyed through the branches of the ophthalmic and maxillary division of trigeminal nerve and the pterygopalatine ganglion branches. Coming to the special sensation from the upper part below the cribriform plate, there is the special sensory nerves, that is the olfactory nerves. And coming to the lymphatic drainage, from the anterior half, the lymphatics drain to submandibular lymph nodes. From the posterior half, they drain to pharyngeal and deep cervical lymph nodes. After learning about the nasal septum, its bony and cartilaginous contributions, its blood supply, nerve supply and lymphatic drainage, now let us discuss about the clinical importance. There is what is known as septal deviation. So the septum will be deflected to one or other side, causing nasal obstruction. So unilateral nasal obstruction, it can cause blockage of the nasal cavity on one side and it may require surgical correction. In this picture, you can see it deviated to one side, narrowing the nasal cavity, and this can be due to trauma or congenital defect. So it may involve cartilage part or both cartilage and bony part. That's about the nasal septum and the clinical importance of septal deviation. Let us consider some more. The corrective surgical procedure that is performed for septal deviation is called septoplasty. So it's a corrective surgical procedure to straighten the deflected nasal septum. In this picture, you can see a case of septal deviation with a narrowed nasal cavity on one side and a wider one on the other side. This is before surgery, and after the septoplasty, the two nasal apertures are symmetrical. So that is about the septoplasty. The other clinical importance of nasal septum is bleeding from the nose, which is also known as the epistaxis. The Little's area, that is antero-inferior part of the nasal septum, is the commonest area for bleeding, and this area is known as the Little's area or Kieselbach's area, where we have studied about the Kieselbach's plexus. And the rupture of vessels in this part of the septum will result in severe bleeding, and the causes for this bleeding is the digital trauma to nasal septum just inside the vestibule. This is seen especially in children and old people, and the commonest thing which they will be doing is the nose picking. And the treatment is pressure on the septum and an appropriate nasal pack to stop the bleeding. So by applying pressure over the anterior part of the nostrils by pressing them for about 20 minutes will arrest the bleeding. And in old age, there will be sudden bleeding due to spontaneous rupture of the blood vessels in the nose. And these vessels will be in the posterior part of the nose, and the rupture of these vessels, which requires a surgical cauterization also, and sometimes ligation of the vessels, and surgical intervention may be required in severe cases. So that is about the nasal septum, the bones forming it and the cartilages contributing for it, the blood supply, the lymphatic drainage and nerve supply. and the applied importance of the nasal septum.